Hi everyone. I just came out of, shocking, a doctor appointment. It's been like a ton of them. I'm just about, let's see, it's middle of May, and my double mastectomy was in August. So I have a lot of appointments coming up. Well, actually, this was the last for a bit because I'm hitting the 2-year mark. Post-surgery, although a lot of my appointments are like a 1-year follow-up because I had issues obviously going on before I hit the 1-year marks, and then they started the clock from then. So today was my 1-year follow-up after my double mastectomy with what would have been my breast surgeon, but my breast surgeon has moved to Texas. So she's not there anymore, and I just found out today that the nurse practitioner, who actually was the one who I originally met with the first time I ever went to the breast center, that really started me in this whole journey, because she was the one who was setting up my MRI and stuff, and she just had a baby, and now she's not coming back because she's spending time with her baby, which I think is awesome, but then like everyone's leaving. So that was my appointment today. A monumental thing about today, it is May 15th. May 15th, 2023. As of, I believe, May 11th, 2023, you don't have to wear masks inside of hospitals anymore, which is very bizarro. I walked into the hospital without a mask, but then I'm like, nope, hand sanitizer. They still have the stations when you walk in to put a mask on. So I still put my mask on when I got in there. And then, because I'm like, I wasn't sure, because it's the cancer center, actually it wasn't the cancer center, it was the breast center. The breast center is where you have like mammograms and, well, it's imaging. That's pretty much what you have. And if there's something like wrong with your boobs, you go to the right door instead of the main door, and that's the breast center. And I've always had the same room when I've gone in the breast center, except for today. So I feel like I've graduated out of the big room, because the big room is where you sit in when you bring someone else with you to like help you listen to all the information. When they tell you you have breast cancer and here's what they're going to do, and all the information's like, boom. I've mentioned before, I'll say again, the voice memo app on iPhones is phenomenal. So I highly encourage you, if you're going through this whole crap show, to use that voice memo app, and then you can put a title on it. So like, I have the audio recording still of that first appointment that I had with the breast surgeon, explaining to me like all the in situs and the invasive ductal carcinoma, and that was where I got the name from this log from, because it was so many words that I'm like, huh? What? Anyway, so what to expect. Like I said, this is the 1-year follow-up, but I'm very uncomfortable in my angling of my chair. My hair is so gray right now, but I'm just kind of owning it. There we go. So it was my 1-year follow-up today after the surgery. So it's interesting because I haven't had a follow-up with my breast surgeon since all this stuff happened. I did have an appointment with her because something was wrong and I couldn't remember what was wrong. Like I was probably having pains or something and didn't really know what was happening. And at this point, it was so long ago, I don't really remember. I know it was like, well, it was a year ago. It was May of last year. And I think I just had like a lot of questions, and I didn't really know like what happens to the breast surgeon after all this stuff happens, because you kind of just get moved over to oncology. And I'm like, what, do I never see my breast surgeon again? I love my breast surgeon. She's phenomenal, and all the people in Texas are thrilled to, I'm sure, have her. But it's weird it's a good weird, I guess, that you're transitioning out of needing them, because the main person that's like the leader of the show is your oncologist. And again, I'm not like super thrilled to even have an oncologist. I don't want one, but I need one. Anyway, so I met with a nurse today. She was very friendly. What was weird was she had no mask on, so I took my mask off. I had a purple like gown on, just the top part. What was weird is that I realized that this is the first time I'm going to a doctor appointment since all this shit's happened, where now without the masks, they can see my face and they can see my boobs. So I was nervous. I was nervous about them seeing like me as a whole from like head to torso, because like it's easy to hide behind a mask. It's covering most of your face. It's more impersonal. It makes your boobs just seem like they're just objects that they're checking. And I said to her too, because like I told her I was nervous, and I'm like, I don't know what to expect. I don't know, like they don't give you a book, you know, what to expect when you're not expecting cancer. What's everyone's role? And I don't get why I'm doing this. And I have no problems asking questions, and they like that I ask questions. But I said to her I didn't quite understand the role of what they play at this point. So she said how like oncology is like running the show pretty much, and it's up to me. Like I can choose not to go back to the breast surgeon if I don't want to, but they still would like to see me once a year till I hit like the 5-year mark. And then the 5-year mark, she said, usually plastics chooses to do an MRI at that point just to make sure stuff is going like okay, you know, on a deeper internal level. And that was weird to hear too, because I'm like, 5 years, like that's a long fucking time to just assume you got all the cancer. I mean, granted, I'm on, like I have no breast tissue. I'm just waiting to get a comment. I'm just waiting. Because I put an Instagram post up today about like, I don't need any mammograms. And I'm just waiting for someone to say, oh, look at you. You don't need mammograms. To which I will say, and I'm not going to drop the F-bomb 1,000 times, even though I'm sitting the same place that I was when I did the F-bomb vlog last time. I'm just waiting for someone to say, oh, you're so lucky that you don't need mammograms. Lucky you, because, yeah, mammograms are not enjoyable. But you know what's even more not enjoyable than mammograms is having your fucking boobs chopped off. So if you're going to think about even putting something on there about, oh, lucky you, you don't need mammograms, please stop your finger and stop fucking typing, or even don't even say it out loud, because I might just, like, lose my fucking shit. How far is my Lupron away? I'm pretty sane right now. Yeah, the Lupron's still a while away. I feel like I just had my last Lupron. Yeah, but don't do that. Don't do that. That's a big no for cancer survivors. Do not say to them like, oh, you're so lucky you don't need mammograms. Like, you're so lucky you don't need a fucking shot in your arm every fucking 4 weeks and a day. That makes you into a raving wackadoodle. Granted, I can expect what my wackadoodleness is going to look like in the timing, but don't do that. Don't do that. Do not compare a mastectomy to a boob job. They are not the same thing. I am not having a mammogram because I don't have any breast tissue. So just like swallow that for a minute. And I'm trying really hard not to be punchy about it, but it's just, it really bothers not just me, but a lot of other breast cancer survivors. Oh, I'm like advertising here. Let me do that. It's not just me. Like it's a big thing to just say, you know, oh, you're so lucky you don't need this. Like, lucky. You're so lucky. Really? I would think that I was unlucky because I was the one in whatever 5 women that leaves the breast center and gets like shit news. And it was interesting. Well, I'll keep it chronological here, but so no mammogram. She said if there's an issue in the meantime, they would do an ultrasound, which I think are very effective, especially if you have dense breasts. Ultrasounds are effective. I visually saw my tumors through the ultrasound. The mammogram from like a layperson, it's hard to, the MRI from a layperson standpoint, it's hard to read an MRI because it just looks like different shades of white. Like I looked at my MRI scans and I couldn't really tell what the heck was what. So I didn't really find that very effective. But the ultrasound was very clearly seen where my tumors were. So yeah, and so one other thing I talked about with her, and then I'll explain the physical part of what she did today. Because actually my boob is a little bit sore right now from her like manipulating, which was just odd. Given the whole flooding situation for me and the dry cleaning and all that kind of shit, I wore a shirt. I don't think I've vlogged. I know I haven't vlogged since then. I wore a shirt the other day that was in my dry cleaning like pile of crazy from the flooding, and I didn't have anything on underneath, which is great because yes, it's great for that point that I don't have to wear a bra. Like, not all the time. Implants are fucking heavy. I don't think I didn't realize, like, they're really heavy. They're not like the same. They're solid. Like they're heavy. So if you don't wear a bra, like at least for me, I can't imagine not wearing a bra all the time. Like if I don't wear a bra one day, like I've got to wear a bra the next day. Like I have a sports bra on now, which has been working for me. But I wore this shirt yesterday without a bra, and it was one of the dry clean shirts from the flooding that was, cleaned. And I got this like weird rash. It's gone now, I think, because she didn't see it. I got this weird rash, and my skin's sensitive anyway. But then like my head starts going with like, okay, what was just absorbed into my skin that's giving me this rash? Is my cancer going to come back? Because now I just put chemicals on my scars, and like, is it going to seep in through the skin and like find one of the lymph nodes that was okay and like fuck that one up, and like here we go again. And I get like, you can't get breast cancer twice, but you can have your breast cancer like spread to other places, and that's why you're on things like tamoxifen, because if there are any like lingering cancer cells, that's what the tamoxifen's for, is that it kind of cuts off the receptors so that it can't those cancer cells, if you're on tamoxifen, would be fueled by estrogen and progesterone. Like that's what they eat in order to like stay alive. So if you want to kill off those cancer cells, the tamoxifen basically takes off the feeders on the outside of the cells so that they can't feed off any estrogen at all, and they just like die and then they're gone. That's the quick version of what tamoxifen does. But I asked her about like, I told her about the flooding and about the dry cleaning and my paranoia with stuff. And I'm glad I brought it up to her, and she gave me like a very detailed non-answer, but it was an answer enough for me that it's like most anything else. Like there's a billion things in this world that are carcinogenic, and there's no way to just like, you could do study after study, but like, how do you know what specific chemical would cause something in your dry cleaning when you have all these other factors going on? Like, did you have a glass of wine today, or did you burn your food a little bit too much, or whatever other billions of ways of, did you pass the one that was smoking and they puffed some smoke into your face and now you have those carcinogens? Like there's just too many factors to know. And that's what sucks about cancer as a whole. Like not the journey, the actual like, cancer cells, that it's just so complicated to like pinpoint what it is to make it stop. Otherwise, clearly they have like a cure for cancer at this point, which, they don't. So, yeah, but she taught me enough about like airing out the clothes, or just, washing them again for the ones that can be washed. But there's no way to know for sure. And just like when you have a glass of wine, it's like, okay, I'm putting hormones into my body right now. Why am I choosing to do that? I have a weird relationship with alcohol right now. Like, I don't know. I tend to stay more away from wine because of the hormonal aspect. For some reason, I think if I drink a mixed drink that has like, puts more hair on your chest, then maybe that wouldn't be as full of or hormones or whatever, because it's so like potent. It's all the stuff I'm making up in my head. I don't know. It's a weird relationship, because you go to like these breast cancer functions, like these, breast cancer support functions, and they serve wine there. And I'm like, but I thought you're not supposed to drink alcohol, let alone wine, like to keep the breast cancer away. But I felt like I got enough of answers from her, and I get it's a very personal thing. It's very much about having control. I'm so sick of hearing that, but it's true. Like, what do you have control over and what do you not? Do you want to take all your clothes and throw them away? If you're a millionaire, then you probably can do that. I'm not a millionaire. Can't really do that, which is partly why I wear my work shirt. Because it's like, that's just easy. I can throw that on and be on my merry way. And the bra that I have, I got on Amazon. I will do the bra vlog. That will come. Speaking of bras, she also gave me, which I wasn't aware of, so this is a good fun fact here. She gave me a list. I had that woman's name from Plastics that does mastectomy bra fittings. And they gave me a list of like 10 different places that do it. Some of them are like medical thing. Like one of them is called Northeast Medical Fitting. That sounds so non-frou-frou. I'd rather go to like a boutique. There's the first boutique that's actually on there is the same person that Plastics told me to go to. I'd rather go to a boutique than go to like a medical fitting, you know, to pick out a bra. And she said like they can get pricey because you're paying for someone to fit you for a bra when your body is just like shaped not like I hate to say normal because that's not normal, not like non-cancer or non-mastectomy women's bodies are shaped. But what I also got was a prescription. I had no idea that you can get a prescription for a bra. Because same thing, like if you didn't have reconstruction and you wanted to have like a prosthetic piece for like a bra that you already have or whatever, it's the same idea for post-mastectomy bras. So it's awesome as I just like my, I have to pay my deductible now, so my medical bills are even higher than they were before. And, but it's nice to know that you can get a prescription for bras. So like, please spread the word on that because I didn't know that was a thing. And, you know, going through this whole breast cancer thing is fucking not cheap. I don't know. I think early on I went through like how much my double mastectomy cost. And that's just the actual surgery. There's always ambulances in the background because I'm by the hospital. But this whole journey thing, like the financial aspect is tough. And I can go off about like the medical system or the healthcare system in the US, but I'm not going to do that. That'll be a much longer vlog. But it's all this shit adds up. All the times you go for the Lupron, all the checkups that you have, like everything adds up. Like every month I'm in there for the Lupron. You know how much one Lupron shot? I mean, I have good insurance, but one Lupron shot, I think it's like $850. Like, what if people had shit or no health insurance? Like, what the fuck do you do? The medical or the financial impact on like families and shit. I know people that have taken second mortgages on their home to be able to pay for their medical bills, which is just absurd to me. So absurd. And like right now, like things are like wicked tight for me. I mean, I lost my shit in a flood and my insurance is not doing anything about it. Well, they paid for my clothes to get cleaned with the chemicals on them, but most of them don't fit because they shrunk. But yes, it's nice to know that you can get a prescription to cut down the cost substantially of your post-mastectomy bras. I don't know if it's like a discount, like a percent. It probably just depends on your insurance company. So like, again, if you know anyone going through this, I think that would be a large help. I got the prescription from the nurse at the breast center, not at the cancer center. That's not where I was today. This is just the breast center. Not just, but this was the breast center. So the physical part of today, weird because again, my face is showing and I'm getting my hair colored on Thursday, so I don't really care so much about the grays right now, but it was weird to have like my face showing. And I actually didn't even look down. I looked straight ahead the whole time when she didn't tell me to open up my top. She told me to put my hands to my sides like you would like put your hands on your hips. And I'm listening to her talk. And she's just like poking around and it felt really weird. I must have had a breast exam at my gynecologist during this time. It's been almost 2 years since everything happened. But clearly at a breast center, they're going to be way more like, you know, checking everything than than at like just a regular breast screening as part of your, routine gynecological appointments. So just like be aware that there's a lot of touching. And it feels weird to have your boobs touched. Because some stuff, like, there's a few things, like the armpits. My armpits have some feeling that came back, and large parts that they're not totally numb. It's a very hard way to explain it. It's kind of like when you go to the dentist and like your lip is numb after your procedure, but it's without the tingliness. I don't know how to explain it other than to say, like, you have a body part removed, and like what's left over, you can't feel. I don't know what else to compare it to, because there's no pins and needles, because there's no anything. It just is like she's just pushing on like Play-Doh stuff that happens to be your skin. It's a very weird experience. But just to rewind, she removed 6 lymph nodes. The surgeon, the breast surgeon, removed 6 lymph nodes from my right side and 2 lymph nodes from my left side. So she spent more time on my right side, at least it felt like. So she's feeling all by my armpit. She asked me about swelling, and I totally was not paying attention to what she was saying, so I was just yesing her to death until she asked about swelling of my fingers. And I'm like, whoa, can we rewind to the swelling part? Because my feet, my ankles, and my feet do swell now, which I just assumed was medication. There's so many moving factors, you forget certain things, because I'm missing 8 lymph nodes. As far as I know, there are 30 lymph nodes on your left and your right side, in at least that area. So removing 6 out of my 30 lymph nodes means I've got a, higher chance of things swelling, because it takes longer for like shit to get outside of my body. There's a little bird outside my window. Hello, little bird. He's so sweet. He's picking up like stuff for his little nest. How cute. And then she's like feeling around on top here, which like I can feel. And then she gets to the boob part. And I guess like when you're dealing with plastics and he feels stuff, I feel like he's feeling more around the implant, where she's looking at like your whole breastal area as one big thing. And I guess that was what was so weird. It's like I can process her touching my armpit, but now I have to process her touching my upper part. And then I have to process her touching my implant. And then I have to process what it's like when she's actually touching around my scar. It's like you take your boob and make it into like these little quadrants, or more than quadrants, octodrants, I don't know. And then like even underneath, when she's feeling underneath, it's like everything has such a different feel to it. And my right side, I did not have, I never even talked to her about the lipo. Oh God, there's so many things, like, you just can't remember all of it. Like, I forgot I had the lipo after the last surgery. I was focused on the scar. But I guess it must be fine, because I had, like, bad swelling after the lipo. But I guess it's gone because she didn't notice anything. But they didn't do anything with the scar or my implant on my right side. That was the left side. So I was focusing more on the left side, which as soon as she got to my cleavage area was very tender. They call them like dog ears when on the inside of your implants, or of your scars, I should say. The extra like skin that's left over on the inside, it's more sensitive in that area. So when she touched there, like, I felt weird. And I told her I felt weird. Like, I didn't feel weird about her doing things. She was very good about how she was touching it. The whole experience was just weird about her, not how she was touched, about being touched. It wasn't about her touching. It was about being touched like that in a clinical way in, like, every part of my whole front torso area. But she said everything felt good. It's just, I feel a little, I trust them and I like them a lot. But the process feels violating. And especially not having the mask on, it's like violating, and now it's not anonymous anymore because they can see your face. And I have a horrible poker face, so like I wear my emotion on my sleeve. I didn't cry or anything. It's just like I feel like I want to cry now. It's a weird feeling for them to be touching like that. And I thought I would just like be in and out today. Like it was a pretty quick appointment, but I wasn't expecting like I'm having a little bit of sensory shit going on right now, just because they were touching so much. Or she was touching so much. And it didn't hurt. Like I told her the inside of my left boob, because she cut into the same scar as my mastectomy scar. So of course that's more sensitive. But it doesn't last long. I told her I still have zingers and stuff. Every once in a while I'm just like, and either one of my boobs in any particular spot, which is just normal. And maybe it's even good because it's like nerve regeneration. She said too that, like even though things are numb now, like you can still get some more feeling back. Like she's not saying you're going to get all your feeling back. I can't imagine that happening to anyone when a mastectomy is such a brutal surgery. I can't imagine that someone would ever come out of that and have like full feeling of their boobs. I would think that that's like medically impossible. But it was just weird. So I'm just feeling weird. And my jeans are very soft, and I don't want soft. I need hard. I have like 200 kindness rocks at home, half of which I have to paint. And like, I don't have any in my car because I want something rough right now because I'm having some sensory weirdness going on. All right, I'm gonna go find something. Maybe I'll see if there's a rock outside or something I could just like rub my finger on because I'm feeling weird now. So, which is why I like to do these vlogs for other people, that hopefully it's helpful, because like you see the description of like, yeah, it's just a check-in, but you're not getting like the impact that has on like what the rest of your day is going to be like. And I never had sensory issues before all this shit happened, by the way. I know some people have sensory issues all the time, but I was not one of those people at all. Yeah. All right, I keep getting all these like notices, so I have to get my show on the road, get to work, get distracted, and find a rock. Just the rubbing of the rock, I can actually see one of the steps there. I think it's a piece of concrete. Actually, I'm gonna go grab it. Just like the rubbing of the rock gives me enough like sensory stuff. And like I don't have my safety pin drama is pretty much like ending. I think all the clothes that had safety pins are now like unsafety pinned. So I'm slowly regaining feeling in these two fingers. So I might have to use a different finger for the rock, but that's where I am too. Okay, that's all I got for you. So those breast cancer warriors out there, survivors and thrivers, you know, you keep rocking on with your bad cells, because this is a journey, man, and it's time to like blast that 80s rock. There's a great station on Pandora, 80s rock, 80s metal hair bands, I think is what the playlist is. And it's a good like, yeah, like kick-ass kind of empowering, because if you know the songs, you can like sing along to them and stuff. It's an empowering playlist. Actually, something weird I'm looking at right now, the zipper on my purse and on my wallet would actually help too with the sensory stuff. So I'm going to leave now, and I'm going to grab that piece of concrete in case the bird picks it up or something. And I will check in with you guys in a while. I don't have any doctor's appointments coming up for a while. Actually, I think the next one I have is my next Lupron, so it'll be a few weeks. There should be something physically that changes in the next 2 weeks if all goes as planned. Something I do have control over. So, yeah, stay tuned. All right, see you soon. Bye.